Hello, my name is Jody Scholes, and I am your instructor for the MBLEx review course. Welcome. Hey, so glad you're here today. And I love this subject. We're going to be talking some anatomy today. It's not my strongest subject, but I love talking about it because the way we cover anatomy, the light bulbs just start to go off. So today we're going to be doing anatomy, and we're going to be doing it of the pelvis and the leg. I know. So anatomy, that's what we're going to be covering today. Then we are going to, let me let other people in. Then we're moving into doing some dissecting the questions as well. So we're going to start off, we do our class in 3 parts. So again, we're going to do our class in 3 parts. And the 3 parts are test taking strategies. So I like to give you a little bit of information about the actual exam itself so that you are well equipped and understand what kind of test this is. Because the MBLEx is not just about the knowledge you have as a massage therapist. The MBLEx is also a test on how to test. So we need a few strategies about taking the actual test. Because I don't know about you, but did you take a 2-hour test in school? You know, did you sit down and take a 2-hour computer-generated test in school? Maybe, but a lot of us didn't. So that's what part 1 is about. So we'll cover part 1 in just a moment, but part 2 is the learning. And today I mentioned it's anatomy of the pelvis and the leg. And then we'll move into dissecting some questions. All right, let's get started. Okay, so the test taking strategy for today is I wanted to tell you about the style of test that the MBLEx is. This style of test, you know it's computer generated, you know it's 100 questions, you know you've got 2 hours to take it. It's about an hour, 50 minutes actually, that you have to take the exam. But what I wanted you to be clear about is that the MBLEx is a computer adaptive test. Okay, so what that means is that this test is designed to get harder or easier as you go along. Now, your goal is to score 660 points. Out of this 100 questions, all of the questions are weighted differently. They have different amounts of points. The harder questions are worth more points. The easier questions are worth less points. You will start off your exam with moderately difficult questions. They're not going to be super easy, but they're not going to be super hard. From there, that test algorithm will shift based on that very first question that you answer. It will ask your next question a little harder, or it'll ask your next question a little easier. That's called a computer adaptive test. Now, some graduates have been like, oh my gosh, that's horrible. You know, it's going to get harder. Well, yeah, it's going to get harder, but it's actually helping you because the harder questions are worth more points. And so you want to get to 660 points as fast as possible. Well, not as fast as possible, but you definitely want to get there. And so by answering a question correctly, you get the points. So I wanted to specifically explain what the computer adaptive test means because inevitably, all the time, on almost every test taking experience that has been shared with me, they're like, oh my gosh, that was so hard. Well, yeah, it's going to be hard because that test is going to get harder until you reach a point where, okay, I can't answer the question about the mitosis of the cell. You don't need to know that. However, we want you to have the best chance to score as many points. And so again, just so that you understand that as you get hard questions, that's because you're doing well. That's a good sign. If you're getting hard questions, that's a good sign. So just know that the questions will be at some point difficult. They will be at some point maybe a stumper. You know, like, ooh, what was, I don't even know that. I don't even understand that question. That's okay. No need to freak out. No need to worry. That just means that you're getting some of these difficult questions because the computer has adapted, because you've gotten so many right. So you can be like, oh, all right, I must be doing okay. Now, pretty much everybody tells me, and when I took the MBLEx, I felt this way. You could have told me I got every question right. You could have told me I got every question wrong. Honestly, like, it was that confusing. It was that weird of a test. But rest assured, I want to give you one more piece of knowledge about test taking strategy so that when you're taking your MBLEx, you know eventually there's going to be some really difficult questions. And that's okay. You're not supposed to know everything. Just need to score 660 points. You can do that. You can do that. All right. Let me switch gears now, going into part 2 of our time together. And part 2 of our time together is the learning. I just love, I have this beautiful memory of my nephew, and he was in first grade. He's graduated from high school now, but he was in first grade, and I said, hey, Will, what'd you think of school today? And he's like, oh, Aunt Jody, it's just learn, learn, learn. And yeah, sometimes preparing for the MBLEx, it's like learn, learn, learn. Yeah. So, but eventually it starts to stick. This learning, I talk at times about the tipping point of your learning. And all of a sudden, things start to seem familiar. Things start to seem like, oh, wait a minute. Yeah, no, I know that muscle. Wait a minute, I know. And that's when you know. That's when I know that you're ready. So let's get into some learning. And so I want to say thank you very much. The slideshow from here. There we go. I want to say thank you very much to the makers of these images. And I'll remember their name in just a minute because my screen is blocked. It is, thank you to, I'll think of it in a minute. Anyhow, I am using these images with permission from Trail Guides to the Body. Trail Guides to the Body. They do such a great job. And we have a lot of their information today. This may be something you saw in school as well, but there's a lot of great resources out there. Just want to give a shout out to Trail Guide to the Body because they let me use these images. So today we're talking about the pelvis and the thigh. Let's take a look at our anatomy. All right, so here we see where the erector spinae group would be. So remember that erector spinae, those are spine muscles, right? On either side of our spine, they keep our spine erect, erector spinae. So that's where the erector spinae group is on both sides. In fact, the spine makes a little channel through through in between those two sides of the muscles. Here is where your iliac crest, where you can palpate the top of your pelvis. I was going to say the top of your hip. And we got to be careful with our anatomy, right? So the hip, when I talk about the hip, it's actually the hip bone. So the hip itself is the head of the femur and the acetabulum, right? The acetabulum. So the hip joint where that hip femur goes into the hip joint, that is actually technically the hip. So the iliac crest is the top of the pelvis. And that's where we see this here, top of the pelvis. This is our glute max, gluteus maximus. This is what we refer to as the gluteal cleft. Yes. Now, some people will say the crack. Let's not use that term. It's the gluteal cleft right in here. And with proper draping, you will learn. I am very specific about secure draping. I won't even post a video that doesn't have secure draping demonstrated. So secure draping means that you do not see the gluteal cleft, right? So I tuck in under right here, even tuck in around the belly. I just tuck it in so there's a nice secure start to the sheet and that it's going to stay there, because as we work that back, as we do compressions, that sheet can move, right? So we want our client to be able to relax, so we securely drape, covering the gluteal cleft. At the tailbone, right here at the bottom of the spine, that's where you see the coccyx. We won't see it, but that's where it lives. The sacrum, we'll see the bones of the sacrum here in a few minutes. This is the posterior, superior iliac spine. We'll be talking more about these bony landmarks when we kind of take away the muscles and the skin. Right now, we're just going over the geography, if you will, of the back side of the body. So the gluteal fold, it's under where the butt ends. This is where the hamstrings live. The hamstring tendons come down on either side. And then we've got some popliteal fossa. That just is basically the back of the knee. And those are what we want to cover for right now as far as the lay of the land, if you will. All right, let's talk for a moment about fascia. Because we've got, we see all this skin, we know the muscles, we know there are bones, but covering every single muscle is a material called fascia. And fascia is the layer of slippery tissue. It's usually slippery underneath the skin. So if you've ever seen a chicken, have you ever bought a chicken and we're either going to take it apart for chicken parts, or you're going to roast the chicken yourself, but when you peel back the skin of the chicken, there is this kind of slippery, clear stuff. That's fascia. Now, sometimes you'll see gristle on the chicken, right? That white, cloudy stuff. That is fascia that has been overused. Now, the beautiful thing about our fascia and being alive is that once we warm up the fascia, it gets clear and slippery again. And fascia surrounds our muscles. It's what allows them to glide against each other. Fascia surrounds our organs. It's what allows it to glide against each other. So fascia surrounds all of these things. It's prevalent, very prevalent in our body. And so we hear sometimes about a pathology called plantar fasciitis. And so you can see here, I've made a note of it here. Itis means inflammation. It's the end of the word. So when we see plantar fasciitis, we know that itis, like arthritis, bursitis, means inflammation. So plantar fasciitis means inflammation of the plantar fascia, and that's on the bottom of the foot. Now, it's actually contraindicated to work directly on the plantar fascia when it's inflamed, so we have to work around it. But even in the bottom of our foot, we have fascia. So just want to know that even if you're not thinking about it during your massage session, you're touching it, you're warming it up. So, and when we talk about fascia, we can do a little skin roll. Did you learn that in school, how to skin roll? So that's a diagnostic tool that we have to see if the fascia is moving. So like, for example, on a scar tissue, You know, those scars, sometimes they get stuck, they don't move. That's considered an adhesion that includes the skin, the fascia, and the muscle. So depending on how old the scar is, that's something that we could explore to see if we could introduce some movement there. Not on new scars, but on old scars. Let's continue on. Take a look at the bones of the pelvis and the thigh. So you can see the bones we were talking about here. So let's take a look here. Well, all right. This is a side view. And you can see here that there are two big bones on either side. So here is the ilium. I'm just looking to see if it's marked. There we go. There's the ilium, this nice big bone. Down here we have the ischiums. That's where we get the ischial tuberosity. We'll talk about that in a minute. And then we've got the pubis bone. That's where we get the pubis symphysis, right? The pubic symphysis, the pubic symphysis. All right, but let's go ahead and take a look at these other areas that are marked. You can see here a view of the sacrum. We're kind of looking in through the belly, so we're seeing the underside of the sacrum. Here's the spine. It comes down and turns into the sacrum. Here's the coccyx. Now, look at the spelling of this, the coccyx, right? C-O-C-C-Y-X, that's the little pointy part of the tailbone. Sometimes you hear about people who have a bad fall and break their coccyx. Just in case it comes up on the MBLEx, the hip is also called a coxal joint, C-O-X. We don't hear it that often, but just in case, so that you have a clear distinction. We're not talking about the tailbone when we say the coxal joint. So the scientific name of the hip is the coxal joint. I know, maybe you haven't seen that in a while. All right, so the femur is here. This is the long bone of the upper leg. And that's good enough to know on this page. So here, I'd like you to go ahead and palpate on yourself the anterior superior iliac spine. So the ASIS is a bony landmark. I don't know how much they would have covered that. Hopefully they covered it with you in school, but it's a bony landmark that we use to determine whether someone has a tilted pelvis, whether they have an anterior tilt or posterior tilt. So it's a bony landmark. Here you see ASIS, anterior superior iliac spine. And this little bone right here, you can palpate it on yourself. So right here in the front. So you've got your pelvis, you got your iliums here, right? And then right in the front, that is the ASIS bony landmark, the anterior superior iliac spine, the start of it is right there at that little bony prominence. Yeah, see if you can locate that on yourself. And so that ASIS is a ridge. It's like the ridge of a mountain, right? It goes right up. And then as soon as that mountain crests, it begins the PSIS. So anterior superior iliac spine, posterior iliac spine. It's posterior superior, but so PSIS and ASIS, but ASIS is the one that comes up all the time. So just so you know, that, and you see here a nice picture of it. So this is the muscles that surround the ASIS. But here's a nice picture of the pelvis right there, that little bony landmark in the front. And here he's cupping the PSIS, part of the PSIS. Okay. So down here on the ischiums, these two little bones down here, is the ischial tuberosity, otherwise known as, let's see if we put it in the chat. Here's the chat. Well, the ischial tuberosity is called what? Oh, there we go, Dawn. There we go. Yep, yep. Yes, they're called the sit bones. And right now, go ahead and move your gluteal folds. Remember, we just talked about the gluteal folds. Go ahead and move your gluteal folds. And are you sitting on your sit bones? So go ahead and sit right on your sit bones. See if you can palpate them. Go ahead and feel that. Yes, those are your sit bones. That's also the scientific name of your sit bones. Are called your ischial tuberosities. Your ischial tuberosity. This is how you spell it right here. Yeah, and it's those little sit bones. We care about that because it's where the hamstrings attach. And so sometimes when working the hamstrings, we have to go all the way up to the sit bones to get to the attachments, the tendons of the hamstrings. But hopefully working the belly of the hamstrings will be enough. We'll see the hamstrings in just a moment. But that's why we care about the ischial tuberosity, because we sit with good posture when we sit on our sit bones, but also it's where the hamstrings attach. Let's take a look at the greater trochanter of the femur. So here's the femur, that long bone on the upper leg. And we have a greater and a lesser trochanter. And so trochanter is just a bony landmark. And it's an attachment point for a bunch of muscles as well. But I just want you to be familiar again with the language. The greater trochanter is on the lateral side of the femur, the head of the femur here. And the lesser trochanter is on the medial side. Ooh, you can actually see it really good here. Here's the lesser trochanter, and here's the greater trochanter. And it's just a weird bump on your femur. It's at the top. But I just want you, again, to be familiar with the language so that if you see trochanter, you'll be like, what? What is that? No, you know you've got a greater and a lesser. It's at the head, it's at the proximal end of the femur, right here and here. And you can usually feel it on yourself. It's what you think of as your hips. It's where we get measured when someone's taking our measurement of our hips. That's our widest point, those greater trochanters. And also just taking a look here, the femur actually moves medially and laterally in rotation, but you can palpate that at some point if you like. All right, let's talk about the muscles of the pelvis and the thigh. All right, so we've looked at the kind of the geography of the area. We've looked at the bones. We've looked at some of the bony landmarks. Let's take a look at the muscles. You don't need to know all of these muscles, but to know that they're part of the lower body would be good. All right, so here, let's start off with the psoas major. The full name of the psoas is called the Ilip psoas, I-L-I-P S-O-A-S. Oh, here it is. Yep, right there. So psoas major and minor form the Ilip psoas. That's how you spell the. We typically, between colleagues, we'll talk about the psoas. Normally, we're talking about major, the bigger muscle. So here's the psoas major. And then we get a little minor in there. Here's ASIS, right? Anterior superior iliac spine. We'll see a better picture of the iliacus in a moment. But this is coming down into the leg. So here's the quads, right? So vastus medialis, vastus lateralis, quad muscles. Vastus medialis, look where it is. Medial, right? Right here. And then vastus lateralis. Lateral, right? The vastus lateralis. Good. And then we've got the rectus femoris and the sartorius. Sartorius is the longest muscle in the body. So you see how this says iliotibial tract right here? So that is your IT band. The iliotibial tract is where your IT band lives. And that's on the outsides, right? So it's on the outsides here. Goes from about the hip bone down and inserts on the lateral aspect. You can see here on the lateral aspect of the knee. Good. Inguinal ligament. Where's that's actually just ignore that inguinal ligament. The reason I say ignore it is we'll see a better picture of it later. And just to know that the inguinal ligament is actually part of the lower body. TFL, we'll see a picture, a lovely picture of TFL on the lateral side, but again, that's just above the IT band in that little kind of nook of the ilium. That part where the hips kind of go in a little bit, that's where the TFL lives, tensor fasciolata. Sounds like a drink at Starbucks, right? All right, let's continue on here. Oh, no need for that. Okay. So the muscles of the pelvis and thigh, this is, again, just a good review for you. Where do these muscles live? Glutamus maximus, right? The big old butt muscle. Here's the TFL, tensor fasciolata, above the hip bone in that, see how that, you know, the hips kind of, excuse me, the ilium, kind of, the iliums kind of go in just a little. That's where the TFL lives. Glute medius is up here. We don't see glute minimus. Okay. Max. Here again, a nicer picture of the iliotibial band, iliotibial tract. And then we've got the hamstrings. We have 3 hamstrings versus 4 quads, right? So 3 hamstrings, quad is for number 4, right? So quadriceps. And so our hamstrings are here. And so you'll see we've got the semitendinosus, the semimembranosus. Oops, that's over here. 1, 2, and this is the biceps femoris. Now, hamstrings, posterior compartment of the leg, right? Wait a minute, biceps? Huh? Biceps femoris, right? Femur, because we know biceps, right? Biceps, right? Are usually here. Biceps brachii. That's upper body. Brachii is upper body. The brachial plexus, the biceps brachii, the brachialis. Those are all upper body stuff. Look at this though, biceps femoris. Femur. That's your giveaway that you're talking about a hamstring and it's in the leg. Biceps femoris. Okay, good. And then we got the 2 other hamstrings, semitendinosus, semimembranosus. Those are just memorization. Those are 3 muscles you actually do need to know. Not necessarily how to spell, because I couldn't spell them, but that you know that they're part of the hamstring group. Okay? And remember those hammies go all the way up and they attach at the ischial tuberosity. We'll see that. So we have a little piece of the gastroc here. The gastrocnemius is the calf muscle, that heart-shaped calf muscle. Okay, again, lower leg. Good. Feel free to review these. You know, this video will be posted later and you can come back and just gaze. Oh, and here's a way to, the semi-sisters. That's one way you can remember that they're hamstrings, the semi-sisters, semitendinosus, semimembranosus, and biceps femoris. A little bit more, another view of the muscles of the pelvis and thigh here. So we've got some fascia that they've drawn in here. Lots of fascia that surrounds all of these muscles. Again, that's what makes them glide, right? And you can see a nice little tensor fasciolata right in here. TFL. Ooh, I'll tell you, so often people do not massage that high up into the hip. Try it sometime. Get a tennis ball, lay on the floor, get up against the wall, put a tennis ball right at your hip. It actually would be about right in here. See if you can find the TFL and U. All right. So get a nice line here, right? So TFL is going to be right about up in here. So here's my hip joint. It's going to be all up right in here. In this area here. So ilium, right? So the ilium is here. Hip joint is here. Try massaging this area sometime. Ooh, tender. Ooh, yeah. But it's yummy, especially if someone's athletic, if they run or they bike, or if they're involved in like golf and walking, tennis. It's so nice. All right. And then you see the IT band as well, the iliotibial tract here. You get such a lovely sense. And that IT band, how do you work it, babe? How do you work it? How do you work it? I work it from across the body. So I'm standing, if I'm working the right leg, I'm standing on the left side of the table. So we've got that long, we can glide across it. It would be cross fiber, but I'm gliding, I'm not, but then you can petrissage it too. You can petrissage that IT band. It's so nice. All right, good. All right, I don't love this slide, but I wanted to leave it in there because it is a lateral view, and you can see, I wanted to point out that the psoas is a very long muscle. Well, it's not the longest muscle, but the psoas actually starts at T12. Here's the last rib. These are ribs. Here's vertebrae. T11, T12, thoracic. All the thoracic vertebrae have ribs. So that's where this actually starts. The psoas starts at T12, starts back there. Put your hands on your last rib. Can you do that? Maybe doing it this way if that's easier for you, or put your thumbs forward. Yeah. So that's how high it starts, and it comes through. You see the shadow here of it, comes through the belly and attaches at the lesser trochanter of the femur. You won't need to know that for the MBLEx, but you may care to know it when you do continuing ed, if you learn abdominal work, if you do sports massage, if you decide to address some lower back pain. It's good to know where this muscle lies. Okay, right in there. Very good. And so this is a side view again. This is the iliac crest, your ASIS, bony landmark. Good. And all of this other stuff, you don't need to worry about any of that stuff down there. All right, let's take a look at the quadriceps group. So here's the ASIS, where the vastus, where the rectus femoris attaches. Oops. And we've got the lateralis, vastus lateralis, right? We can say the vastus brothers and the semi-sisters. So vastus medialis, vastus lateralis, medial and closer to the body, away from the body. Good. So that's got away, vastus intermedius. And as you can see, the vastus, the rectus femoris, look at how this changes. Here's the muscle. And tendons attach the muscle to the bone. And here it's the patella, this is the patella, the kneecap. So it's coming in right behind and above the kneecap. Scientific name for the kneecap, patella. And then there's the patella ligament. So the rectus femoris and the patella ligament are what guide that kneecap, even though it's pretty much a floater there. Now we do have something called the tibial tuberosity. It's another bony landmark. It's like our ischial tuberosity is a bony landmark on the ischium. Tibial tuberosity, a bony landmark on the tibia. And I'm not going to go through the innervation or the movement. Feel free to take a look at this. If you're getting this kind of question on the MBLEx, it's a tough question, so you can celebrate. Oh, I do want to mention the linea aspera, because now and then that name will come up. And that is it's the attachment point for the muscle. So it's a part of the bone. It's a line. The linea aspera is the line where that muscle is attaching to the bone. All right. Another good look at the rectus femoris. We're going to be winding down here a little bit as we move into dissecting some questions in a few minutes. But you can see the quadriceps as a group. I do mention that a secure drape allows us to work the quadriceps from top to bottom. So how do you drape the quadriceps? Do you do a diaper drape? Do you remember that? Where you tuck it, like you tuck under the knee? So I find it easiest just to use my hand with the palm down and tuck under the knee. And then can take that rest of that sheet up and tuck it under the small of the back. Give it a good tuck. Look, you're tucking under the knee. You're not gonna like hit somebody's junk. That's why people are timid, right? That's why massage therapists are timid about securing the drape on the inside part of the knee or the inside part of the leg. Go ahead and just tuck it under the knee and give it a yank from the other side. Nice and secure. And then tuck at the top as well, because we want to be able to really work that quad, right? Feels so nice. When's the last time you got a massage? Maybe you've forgotten how good that feels. It feels really nice. Okay, so again, we're adjusting here the rectus femoris. And so the muscle, rectus femoris, embeds into the patella, and that's the patella is considered a sesamoid bone. VMO, this is vastus medialis. The vastus medialis is when somebody's a bicyclist, you see that really those big quads in the front. Maybe you watch the Tour de France and you see those bikers. VMO, medialis, right? So the vastus medialis is on the medial side of the quad. And so sometimes when people have knee pain, the physical therapy will be to build the strength in their vastus medialis. So simple exercises, which is out of the scope of our work, but simple exercises could be the kind where you're at the gym and you extend, right? You extend. So you're sitting in the machine with your knees and you have a weight here and you extend the knees. Or step ups or lunges. These are all exercises that address the VMO. Vastus lateralis. So it extends the lower leg, allows the body to rise up from squatting. It's on the lateral side. Oh, and we're going to go back to the hamstring. So great. That was the last look at the quadriceps. And we're looking now at the hamstrings. So see here how those hamstrings attach to the ischial tuberosity. We got the semisisters, and we have two heads of the biceps femoris, but it's one muscle. So they've got a long head and a short head, but the biceps femoris is considered one muscle, and there are 3 hamstring muscles altogether. So a little fun fact here, the term hamstring originated in England. Butchers would put different pieces of meat, would hang them in the window. And so hamstrings. And so the long tendons, that would be where they hung the pork. Wow, weird. Okay, so the hamstrings as a group, you can see here. So ischial tuberosity is pretty deep in there. And this is what it looks like when we're working it. So if someone has tight hamstrings, you treat the hamstrings. Sometimes we work on different parts of the body. We've talked about the reciprocal muscle groups, but in this case, for a hamstring cramp, we do go directly to the hamstring to massage it. And a nice look at the glutes. We don't need to worry about this side of things. Let's just review. We've got a medius, maximus. You see how that moves into the iliotibial tract. And right in here would be piriformis. Surprised that's not already painted in there. But piriformis occurs in here, and so does, we also have a glute medius, glute minimus. Minimus, medius, maximus. Very good. This is also the movements, if you care to see what the movements are. To be honest, I don't really, I don't encourage you to memorize this type of stuff, because there's other bigger stuff to learn. There's other more important stuff to learn. But here is the information in case you want to cover it. And there's a nice picture of the minimus. It's down deep in there. And let's wrap up with the adductor group. And this is, the adductor is also considered the groin muscles. So adductors. So looking at this question, the adductor group produces what kind of movement? I like some of these learning things. Good. Oh, all right. Thanks so much. So question about the vastus medialis. Vastus medialis is a little under the rectus femoris, but it's more medial. We can absolutely access it. And Char said the semi-sisters like to eat ham. I like it. Even better. Yes, here we go. Good. Yes, Eva. Yes, Devani. Yes, Char. Yes, that is the movement. So the adductor group produces adduction. Adduction. Adding to the midline of the body, right? So they're pulling those legs in. So moving from like this to this. So take a soft fist, put it between your knees and squeeze. Those are your adductors. You'll feel them activate. So we've got the longus, we've got the pectineus, we've got the adductor brevis. And here's the gracilis. So just to be familiar with those names, that they're adductors and the movements that they produce. All right. Little recap on the TFL. Lovely little area to work, tensa fasciculata and the iliotibial tract. A few other names, a few other words. So the distal end of the iliotibial tract. So the distal versus the proximal end. Think again, all of these directions are from anatomical position. Anatomical position is standing up, facing forward, palms facing forward. So that makes the thumb on the lateral side, the pinkies on the medial side, feet facing forward. All of these directions, distal, proximal, will always, always, always start from anatomical position. A lovely picture again of the psoas. Right through here. The umbilicus, belly button, approximate. So that usually we can access the psoas by going 1 inch over and 1 inch down from the belly button. That's probably not going to be on your MBLEx, but just if you're looking for it, 1 inch over and 1 inch down from the belly button. Here's a lovely picture of the iliacus. The iliacus is all on the inside of your ilium, all in there. And this again is psoas major, and it's attaching at the lesser trochanter of the femur. Again, little iliacus here, helps to flex the hip. So to know that the inguinal ligament is in the lower body, and some of these are endangerment sites. So for example, the femoral artery, nerve, and vein. So some of this stuff is peripheral. We just need to be careful about working in this area, applying too much pressure. It can slow down the circulation of the blood going through the femoral artery. This is especially important when we're talking about women who are pregnant laying on their back. We don't want to compress that femoral artery because the mom can go to sleep, and that would be bad. Oh, didn't I get detailed here? All right. So feel free to, again, take a look at this. You will want to know about it, the sciatic nerve. Piriformis syndrome is a condition involving the compression of the sciatic nerve. And so just knowing the path of that sciatic nerve. And this is the pain that goes down the leg. Typically, we're going to treat this by working the SI joint, which is the sacroiliac joint. But sciatica goes down the leg. So sciatica is also considered a condition, a pathology of the peripheral nervous system because it's involving nerves. Just a little reminder that there are bursa in almost every joint. So bursa are the little watery sacs. They're in the shoulder, they're in the hip. Inflammation of the bursa, of the trochanteric bursa, is called bursitis. So they're in the large joints, shoulders, elbows, hips, knees. That's bursa sacs. Yeah, so mostly we hear about bursitis in the shoulders and the hips, though. All right. Oh, I didn't have a little entry point for dissecting questions. Are you ready to dissect some questions? It is time to dissect some questions. All right. Take a breath, take a breath, take a breath. 5 more minutes with me. Let's go. 5 more minutes, 5 more minutes. Let's go. All right. The crest of the pelvis is a bony landmark. Its full name is, oh, I see some answers coming up. Ready. All right. So the crest of the pelvis, there's a bony landmark, and its full name is A, the anterior superior iliac spine. So the crest of the pelvis, all right, is it called? B, the anterior subspine iliacus suture. Is the crest of the pelvis called the C, the posterior superior iliacus spine? Or is the crest of the pelvis called the posterior inferior iliac spine? All right, let's see what we got in the chat. Oh, I'm loving it. I'm loving it. Yes, you can take out a few of these, right? So dissecting questions, we can take out, let's see if we can take out stuff. So I see take out B, take out D. I'm going to go ahead and take out, guess I'm not taking out anything. So yeah, so you can take out B, you can take out D, right? So the crest of the pelvis is a bony landmark. We can take out B because subspine suture is not a name. So the PIIS is not a thing either. Remember, it's PSIS, posterior superior iliac spine. So we can take out B and D, which leaves us A or C. Let's look in the chat. Very good. So the best answer, boom, the anterior superior iliac spine. All right, if you had trouble with that one, go ahead and watch this again, because ASIS, it's definitely going to come up somewhere. Like if it's, even if it's not on your MBLEx, when you do continuing ed, if you do anything with anatomy, it's going to be there. Yes. So good job. Good job in figuring out ASIS. Ready for one more? What muscles make up the hamstring group? All right, we just covered this. We have a little memory tool for this. All right, what muscles make up the hamstring group? It's not the quads. Where are the hamstrings? Touch them on yourself. All right, so hamstrings. Rectus femoris, vastus lateralis, vastus intermedius, vastus medialis. B, semitendinosus rectus femoris, biceps femoris. C, semitendinosus semimembranosus rectus femoris. D, semitendinosus semimembranosus and biceps femoris. Can you eliminate one of these? I know you can. I know you can. Which one can you eliminate? Oh, I've got all sorts of answers in here. Yes, Queenie, take out A. That's right. Take out A. You can take out A because those 1, 2, 3, 4. How many hamstrings are there? How many? How many hamstrings are there? Yes, Lauren, yes. 3, Queenie, 3, yes. Exactly, there are 3. Char, yes. There are 3 hamstrings, so we can take out A. Oop. I think I did that on the wrong side. So we're going to take out A with 4 of them. That leaves us B, C, or D. This is not going to happen on the MBLEx, but it happened today for you. The correct answers, the distractions, the wrong answers, the distractors, each have a quadricep in the answer. The correct answer does not include the name of a quadricep. Sounds like a mushroom, doesn't it? Quadricep? Ha, I don't know why. All right, let's see what you got for answers. Yes. Remember, the semi-sisters like to eat ham. Nice. Nice work. Nice work, Char. Yes. New yo. Gotta take a look at that. So, yes, Char. Yes, Queenie. Oh, Juliana, close. You're close. New yo, you're close. But look at letter C. What's wrong with letter C? Semi-sisters, right? Rectus femoris is a quad. Here's a little clue. These are all quads, quadriceps. But you're right. So we have to look at all the answers. Ready? Am I wrong? I think I highlighted the wrong one. The semicisters and biceps femoris. This is the wrong. I did it wrong. See, look, even me can get confused. Rectus femoris is a quad. The correct answer is letter D. The correct answer is letter D. Yes, semicisters, big brother bicep. I like that chart. Big brother bicep. So rectus femoris is in the front, right? Biceps femoris is in the back. All right. Well, good work, you guys. Sorry that I messed that one up. But we caught it. We at least caught it. Yeah. Great work today. This was pretty dense stuff. We talk about anatomy, we talk about pelvis, we talk about the scientific names, we talk about movement. Yes. So great job reviewing this material and starting to get it straight. Next week, we're going to be talking about, I like to go back and forth between anatomy, and hands-on stuff. And then next week, we're going to talk about business ethics and guidelines to a professional practice. So yes, so good work today. Excellent work. And I wanted to say thank you. Thank you very much for making this time today. Thanks for making the time today. It is my vision. The reason I'm here every week is because it's my vision to put amazing, heart-centered massage therapists into the world. And as we prepare for the MBLEx, yes, we do a lot of learning. We learn, right? But also, you start to reconnect with how you want to show up, how you want to show up for your clients, how you want to show up in this profession. Yes, and Leticia says, will make the world a better place. It is. Your zip code where you practice is a better place to live because you are in it. It is the ripple effect of your work. Remember when we throw that stone into the pond, it creates a ripple. It doesn't just have like kerplunk. It creates that ripple. And when people come and get massage from you, and they can get massage from you right now, they can tip you. They can make a donation. You're not charging. But when people get massage from you, your mom, your significant other, your sister, they're happier people. They're nicer in the world because they've gotten massages, because they've gotten massage from you. So I'm going to wrap up. I'm going to stay on for a few more minutes with our live graduates in the class. But thanks so much for making the time, because I know you don't just find the time, you make the time. So thank you for making the time. My name is Jody Scholes. I'm your instructor for the MBLEx review course. We'll see you again real soon. Ooh, don't want to do that.